Hello, I'm Dr. Namratha Damera. I'm a dermatologist and an aesthetic physician practicing in Hyderabad. I'm talking on behalf of Dermavidya. Let's talk about hair fall, commonly known as alopecia. Alopecia can be of four main types. The first one and most commonly seen one is androgenetic alopecia, that is the male and female pattern baldness, which can be caused due to genetics. The second one is alopecia areata, which is a circular pattern of hair fall, which is autoimmune and can also be seen in patients with other autoimmune conditions. The third one is telogen effluvium, and the fourth one is anagen effluvium. Let's talk about androgenetic alopecia, that is male and female pattern baldness due to a genetic predisposition, which is usually hereditary. So the parents, either the mother, the father or somebody else in the family will usually be bald. So in this pattern, in the female pattern, there is thinning in the midline and there is thinning all over the crown of the scalp, but the front of the hairline is always intact. In the male pattern baldness, there is temporal recession and thinning all over the crown of the hair, while the hair at the back of the scalp is intact. So in this male and female pattern baldness, it is usually permanent if it is not treated. Again, in the alopecia areata, it is an autoimmune hair fall, which is usually seen in circular patches, which can become bigger and which can converge and become much bigger and become alopecia totalis and universalis, depending on how much hair you're losing, if it's all over the body. The other type is telogen effluvium, which is usually seen post pregnancy, as in because during your pregnancy a woman doesn't lose any hair due to hormones like progesterone and estrogen, while in the postpartum stage, due to deficiency or the regularizing of progesterone, women tend to lose hair till the 6th month. But the hair does come back. It can take anywhere up to 6 months to 1 year for the hair to come back. And anagen effluvium is where the hair starts falling in the first anagen phase itself. This is seen usually when in cases of chemotherapy, or if you're taking some medication that is causing your hair fall. So the other common causes of hair fall are due to deficiencies. Then it can be due to some hair care practices like heat styling or use of certain mousses and gels regularly in the hair, which can cause the hair to dry out and fall. Stress is also a main reason for hair fall. So let's talk about common ways to prevent hair fall. So if you're somebody who has a lot of hair fall or has started noticing more hair fall in the last couple of months, if the hair fall is more than 50 to 100 strands of hair per day, then that's considered excess. That's when you need to worry about your diet. Diet being if it's rich in iron, vitamin B12, vitamin D, K and minerals like magnesium and selenium. These can be usually found in nuts and seeds, green leafy vegetables, eggs. These are all very important in your diet. And also what you're taking. If you're somebody who goes to the gym and commonly take whey protein, then that in some cases, if you are somebody who has a history of androgenetic alopecia, then that can increase your testosterone, that can in turn lead to more hair fall. So in whey protein, there's two kinds, isolate and concentrate. So a whey protein concentrate is probably a better protein alternative for you if you go to the gym regularly and are taking protein supplements. So again, coming to the treatment, there are a lot of treatment alternatives right now, both topicals and orals. The topicals being two different kinds, minoxidil based and non-minoxidil based. So the non-minoxidil based is commonly like caffeine and procapil and redensil and capixil. These are known to help most of the hair fall patients, but might not be as effective by themselves in androgenetic alopecia patients. So again, coming to oral, if it's male pattern baldness, we usually like giving some oral supplements and oral medicines along with some topicals. One other thing that we can do for hair fall are new techniques like PRP, GFC and exosomes. PRP is plasma-rich therapy, GFC is growth factor concentrate, and exosomes. In this, we ideally draw out your blood in the clinic, and then we eject the plasma from your blood, then inject it back into the scalp while providing growth factors and increased nutrition to the scalp, which will in turn promote hair growth. And these are very safe, minimally invasive, so the results are much better. So in conclusion, I would say if you're somebody who's had a lot of hair fall and you're doing everything healthily, as in your diet is normal, you are managing your stress, and you still have a lot of hair fall, then I would suggest you to visit your nearby dermatologist and get an opinion. Thank you.
For more such videos, visit or log into dermavidya.com.